The following program contains graphic images that may be disturbing. Parents are advised that these images may not be suitable for young children.
Hey, you three, what the hell? You've watched the show. You've seen the videos. Nothing is off limits here. So today, we have some shocking stories. It's going to have you asking that question. What the hell?
What the hell?
What the hell?
What the hell?
Let's start off with this viral video.
Caught them off guard.
I know, they were not expecting
They were
that.
not ready.
So this is actually not what the health, it's what's for dinner.
That's like...
All right, Dr. Batra, educate.
So this video comes out of Miss Foot Fixer. She's out of London, and this is a fungal infection of the nail being chipped away, that infected fluid. So this is obviously a nail that went too far. And when you have a fungal infection of your nail, it has a fancy medical name. It's called onychomycosis. And often starts out as a spot on the nail, but then very quickly will end up with thickening of the nail, chalkiness, kind of brittleness of the nail. And here you can see she's actually filing it away, cutting off the residual nail, and actually even using a water pick to get that infected fluid out. So remember, fungus loves a moist, warm environment. This will often start with athlete's foot. So when you start seeing that rash on your skin, try to nip it in the bud with an antifungal cream. Think about if it gets more involved and you start to see it in the nail, talk to your doctor, because you can start with the topical antifungal lacquer. Oral antifungal is most effective when you get to something like this, but in certain cases you may even need to remove the nail. But prevention is key. So try to avoid walking around in wet, sweaty socks. Try to keep your nails trimmed back and intervene early so you don't get to this video.
So this is a fascinating story. This man saw a doctor after he experienced these hand lesions you're seeing, also had shortness of breath for 6 months. Really interesting case, Dr. Batra.
Yeah, and so this actually is an image from the New England Journal of Medicine. This gentleman had lung disease called interstitial lung disease, and the sores on his hand were representative of a really rare inflammatory condition called dermatomyositis. And so that actually goes along with an inflammation of the muscles. So often people will get weak in their muscles because of the inflammation, and then they get this really interesting skin rash, which is sort of reddish to violaceous. The skin becomes inflamed often around the eyes because the muscle itself is inflamed. But this goes alongside internal diseases. So when you see something like this in and of itself can be treated with anti-inflammatories like prednisone or steroid-sparing agents, but it's often a harbinger of something really serious going on inside. So this gentleman had interstitial lung disease. We see it alongside autoimmune conditions. Certainly it should prompt a screening for internal cancer too. In fact, when I was training, that was the main thing we always worried about missing. But dermatomyositis, pretty rare, 10 people out of 1 million, can be treated with anti-inflammatories. This person cleared in about 5 months of medication.
I think the story highlights the skin is often a manifestation of internal issues, and if you have any skin lesions along with other general systemic symptoms, fever, shortness of breath,
Yeah,
you know, it's time to go see a doctor. If you live in the LA area, you can go see this dermatologist, my favorite, Dr. Batra. No, you have a clinic.
Yeah, I do.
They can come see you in clinic.
Yeah, please, I'll come.
Actually, you have a brand new clinic, right?
Yes, I do. It's Batra Dermatology in Santa Monica, California.
Boom.